So after talking about the acute rhinitis and different types of acute rhinitis, let's talk about chronic rhinitis. In chronic rhinitis, we will talk about the chronic simple rhinitis, hypertrophic rhinitis, and also we will talk about the compensatory hypertrophic rhinitis. So types of chronic rhinitis we have, this is in this diagram, this is just the direction of the airflow in the normal individuals. So chronic non-specific inflammation of nose include usually chronic simple rhinitis, hypertrophic rhinitis, atrophic rhinitis, rhinitis sicca, and rhinitis caseosa. All these are the different types of chronic rhinitis. It can be simple, hypertrophic, atrophic. Hypertrophic is hypertrophy, increased growth of the cells or enlargement, and atrophy is opposite. There is a shrinkage or small inside, atrophy, decreased growth. And then rhinitis sicca and rhinitis caseosa. So all these different things will be different types of chronic rhinitis will be discussed in this section. And then, as I mentioned before, acute and chronic. Acute is short term, short duration. Chronic, it persists for longer duration, and sometimes acute infections and acute rhinitis can become chronic when they are super infected or superimposed by the bacterial infection. So chronic rhinitis. Chronic simple rhinitis. Recurrent attacks of acute rhinitis in the presence of predisposing factor leads to chronicity. So if the acute rhinitis is present and it leads to chronic rhinitis because the predisposing factors, because the causative agents, they persist and the condition is not getting better, it becomes chronic, and then it is labeled as chronic simple rhinitis. The causes etiology is persistence of nasal infection, chronic irritation from dust, smoke, as I mentioned in the previous section, in irritative rhinitis. If there is persistence of causative factors, if smoke is causing irritation and it is present, it is persistent, then acute infection can become chronic. If it is dust, if it is any other allergens, then the condition becomes chronic because condition is not resolving or not getting better. Nasal obstruction due to DNS or deviated nasal septum leads to different rhinitis as long as deviated nasal septum is not corrected, it is present, or if synechia is present, then there is acute infection can become chronic. Then vasomotor rhinitis. And the endocrinal or metabolic factors, suppose if patient has hypothyroidism, then it can persist and lead to chronicity. So all these are the different causes of persistence of acute infection, and it becomes chronic infection. So chronic presence of predisposing factor, DNS, deviated nasal septum, synechia, vasomotor rhinitis, and metabolic and endocrinal disorder. Pathology, what happens is there is excess production of mucus, and there is inflamed mucus also. When there is excess production of mucus, there is inflammation of the mucus, nasal mucosa, and then it produces enough secretion, enough mucus, and that can lead to rhinorrhea. So pathology is hyperemia and edema of mucous membrane. There is enlargement and hypertrophy of the lining of the nasal nose, which is the mucosa. Nasal mucosa become edematous, swollen, hyperemic. Hypertrophy of seromucinous gland and increase in goblet cells, and then blood sinusoids, particularly those over the turbinates, are distended. So the main pathology is the swelling and inflammation of nasal mucous membrane. This swelling and inflammation cause increased production of the mucus. That increased mucus and increased hypertrophy of different glands also cause increased production of mucous membrane that cause clogging and blocking and cause inflammation. Again, the pathology clinical features are nasal obstruction, nasal discharge, headache as a result of obstruction, sinusitis. All these can cause headaches. Swollen turbinates you can see in the nose, and there is post-nasal discharge also. So all these are the clinical features patient present as a result of pathological changes. Nasal obstruction, because there is so much discharge and fluid, it can cause plugging in the nose, and it can cause nasal obstruction, and it can cause even sinusitis and headaches, and swollen turbinates are present. Treatment is usually attention to sinuses, tonsils, adenoids, allergy, personal habits, environment. So all these should be taken care of if there is complications like sinusitis, tonsillitis, and adenitis. Nasal irrigation with alkaline solution, nasal irrigation to remove the secretions so the patient can breathe little easily. That's also important. Nasal decongestants help to relieve obstruction. Antibiotics help to clear nasal infection and concomitant sinusitis. So all these are the treatment options for the chronic rhinitis. Next, also excessive use of nasal drops, sprays should be avoided. A short course of systemic steroids for addicts to spray. So it's important that overuse is avoided because it can cause side effects, and sometimes simple short duration of steroids can be used in patients who are addicts to the use of the spray. This can help them to use the sprays a little less. Next type is hypertrophic type of rhinitis. You can see this is the nasal septum, and this is enlarged inferior turbinate. There is hypertrophy, enlargement, overgrowth. So characterized by thickening of mucosa, submucosa, seromucinous gland, periosteum, and bone. So all these structures, they become hypertrophied, they become thick, and they can cause obstruction. So it can cause hypertrophy and thickening of mucosa, submucosa, seromucinous gland, periosteum, and bone. The causes are nasal infections, chronic sinusitis, chronic irritation of nasal mucosa, prolonged use of nasal drops and vasomotor, and allergic rhinitis. So all these are the different causative factors that can cause thickening of the mucosa, submucosa, and seromucinous glands that cause increased filling of the nares and cause obstruction, and these are caused by infections, sinusitis, chronic irritation. Sometimes prolonged use of nasal sprays can also cause hypertrophic rhinitis. Symptoms and signs are obstruction. Main is obstruction because thickening cause obstruction of the nostrils, nasal obstruction. Thick and sticky nasal discharge, complain of headache and heaviness of the headache, and as a result of obstruction usually patients have an anosmia also, so they cannot smell, or their smelling sense is also affected. Signs are hypertrophy of turbinates. Turbinal mucosa is thick, so on examination, the turbinates are swollen, and person can, or the doctor can easily visualize those hypertrophied turbinates. Shrinkage of mucosa with vasoconstrictor drugs. Maximum changes are seen in inferior turbinate of the nose and hypertrophied entirely or at anterior or posterior end or along inferior border. So the whole turbinate can be enlarged, or it can be along anterior or posterior end or along inferior border. So these are the signs and symptoms of hypertrophic rhinitis. Treatment is nasal obstruction can be relieved by size reduction of turbinates. Because it's because of hypertrophy, usually size reduction is important to relieve the condition of the patient. The size reduction is done by linear cauterization, submucosal diathermy, cryosurgery of turbinates, partial or total turbinectomy, submucous resection of turbinate bone, and laser therapy. So all these are the different options by which the size of the hypertrophied turbinates can be reduced, even partial or complete removal of the turbinates, lasers, cautery, cryosurgery. All these steps can be used, or these treatment options can be used to reduce the size of the turbinates. Hypertrophied inferior turbinate partially removed at interior, posterior, or inferior borders. Now, submucous resection of turbinate bone is done. It removes bony obstruction but preserves turbinal mucosa for its function. Next, compensatory hypertrophic rhinitis. Clinical features of this type include, in case of marked deviation of septum to one side. So if there is marked DNS to one side, as a result of that marked DNS, there is compensatory hypertrophic rhinitis to compensate that DNS. Roomier side of the nose shows hypertrophy. So if DNS on the right side, or septum is deviated on the right side, the hypertrophy usually occur on the left side, which is more roomier, or which has more space. Reduction in the white space occur. Irreversible hypertrophic changes occur. And correction of nasal septum or require reduction of turbinates. So as the name shows, it's as a compensatory mechanism, if there is DNS on one side that causes the narrowing or obstruction on one side, to compensate that there is hypertrophy on the other side, and it narrows the romier cavity and decrease the size of the other side also. So that was all about the section 3. Thank you for watching sqadia.com.